Hi there, I'm Dr. Molly with Birmingham Pediatrics and Campground Pediatrics, and I want to walk you through some of the scenarios around COVID-19 exposure to help you understand who needs testing and who doesn't. Every one of us at some point or another, pretty soon, is going to get a call from someone saying that they tested positive for COVID-19. You will have been with that person at some point in the relatively recent past, and that's why they called you. So here's what you need to know. If you were with that person within 48 hours of them developing symptoms, then you were indeed with them at a time when they were potentially contagious. If you were with them more than 48 hours before they developed symptoms, they were not contagious at that time. Let me give you an example. If you were with a person on Tuesday and they developed symptoms on Friday, were tested on Saturday and came back positive, and they called you to say, oh my gosh, I tested positive when we were together last week, you have nothing to worry about. When you were together on Tuesday, they were not contagious yet, so you couldn't have been exposed. You have nothing to worry about. No testing is needed. On the other hand, if you were there at the same party, let's say on Thursday, and they call you and say, I developed symptoms on Friday and got tested on Saturday, you may indeed have been exposed. So then you have to think about, well, did I really spend time with them? Let's say you were at an outdoor event together. Let's say you were at football practice or band camp or at a family barbecue. Did you spend 15 minutes or more in a short distance from them, 6 feet or less, having a conversation? If not, if you were across the field, or if you never really even talked to that person at the event, then you don't have anything to worry about. You were not exposed. So then you wonder, well, I didn't do that, but my sister did, and now I live with my sister. Don't I need to worry too? The answer is no. Your sister needs to worry, and your sister will enter quarantine. And we'll talk about her in a minute. But you don't need to worry. So let's recap. A person is only contagious for 48 hours before they develop symptoms. If your exposure to that person falls outside that range, you could not have been exposed. If you were in contact with them during the time that they were contagious, you have to then decide, was I with them enough to warrant a close contact? That's 6 feet or less for 15 minutes or more, regardless of whether you were wearing masks or not. If you meet that threshold, then you were considered to be in contact with them, and you enter quarantine. Next question people ask is, well, why don't I get a test? Can I get a test? And then if I don't have it, then I don't have to be in quarantine. Well, that's where you're wrong. If you've been exposed to COVID, there is no test that gets you out of quarantine. Because at any time, from the time you know of the person's positive test until 14 days later, or I should clarify, from the time that person develops symptoms, or the last time you saw that person during their contagious period and 14 days later, you could develop symptoms anytime during that time. So getting a test done, even if you get it done on the right day, 5 to 7 days after your last contact with that person, which would be about the right time, even if it's negative, that doesn't get you out of quarantine. You could test positive on day 10. You could test positive on day 12. So you can't get out of quarantine with a negative test. Many people find out they're exposed. Let's say the person goes for testing on Saturday, gets their test results on Monday. You saw them on, let's say, Friday. They call you on Monday and you rush out and get a test. You actually aren't even contagious yet. There's an incubation period for COVID. It takes 5 to 7 days from the time of exposure to the time you're likely to even have a positive test. So you're going to have a false negative if you're going to end up with COVID anyway. So testing is now only recommended if symptoms develop. You go into quarantine regardless. You're in quarantine for 14 days. And if you develop symptoms, you get tested. Let me repeat. Getting tested does not get you out of quarantine. So if you've had that close contact of 6 feet or less for 15 minutes or more, you're in quarantine. Period. If you develop symptoms, you get tested. And the reason you get tested is so that you know whether or not other members of your family need to be in quarantine. Luckily, right now, our tests are coming back quickly enough that you are unlikely to have exposed other people during the time it took for the first person's test to come back. So you will enter quarantine before you would be contagious to others. I know this is a lot of information. It's confusing and it's difficult, and that's why I recommend that you always have a telemedicine appointment before you rush off and get testing done. Clarify whether your exposure was an actual exposure or what I call a drive-by exposure. Make sure you really need the test if it's going to be a fruitful time to get the test done. Don't get something stuck up your nose if it isn't even going to give you a reliable result. We can do testing in the office. We obtain the test and send it to a lab, and by mid-September, we expect to be able to do rapid testing in the office too. So reach out to us first. We are your resource for answers, for facts, and for testing. I'm Dr. Molly with Birmingham Pediatrics and Campground Pediatrics. I hope that school starts out well for everybody.